Yes, would you do an official roll call, please? I know people have been chiming in here, but let's make sure we got the right count and everybody on. Thanks, Tanisha.
Yes, Chairman, thank you. Norman Boyd.
Here.
Roger Folsom.
Here.
Russell Crutchfield.
Present.
Anthony Williamson.
Here.
Mark Trail. Mark Trail. You may be on mute, Mr. Trail, because I see your name. Okay, we'll come back to Mr. Trail. David Cruz.
Here.
Russ Childers.
Here.
Kenneth Davis. You may have to unmute yourself, Mr. Davis. Kenneth Davis. Mark Trail.
I'm here. You have to unmute me.
Thank you.
I'm here. Okay.
Thank you, Mr. Trail. Kenneth Davis. I see your name, Mr. Davis. You may have to unmute yourself.
Let's make sure that if Mr. Trail said that we had to unmute, let's make sure we're unmuting Dr. Davis if there is such a way for us to do that.
Okay. Dr. Davis, if you're on the line, please say something now.
He was talking earlier, so I think he is on the line.
You know what, Denisha?
And I think,
Denisha, if you could text Dr. Davis or email my cell phone number to him, and then I'll put him on speakerphone if we're having technical difficulties for him to be able to get on. And I'll put that right here by my microphone.
okay, I will do that.
Great. And I'll let you know as soon as he joins.
Thank you. And that concludes my work.
Okay, thank you.
This is a WebEx issue, not, this is a WebEx,
Yes.
it's not our, everybody's experience with it.
Should we go ahead since we have a quorum?
Okay. We've got quorum.
We have a quorum. I think we'll go ahead and Dr. Davis can join us here hopefully as we proceed. I want to welcome everybody and thank you for being on this morning, and apologize again for all of the technical difficulties that we're having. We've got an agenda here this morning to go through, which is kind of lengthy. But first of all, the first thing on the program is to ask our secretary, Russell Crutchfield, if he has read the minutes of the May 13th meeting and would recommend approval.
Mr. Chairman, I have read and reviewed the minutes from the May 13th board meeting, and I found them to be in order and correct. And I move that the board approve the May 13th board meeting minutes.
Thank you. Is there a second to that motion?
Trail will second.
Motion's been made and seconded by Mr. Trail. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, the minutes are approved. I might say one thing, Mr. Crutchfield, congratulations are in order for you. I believe you just completed your PhD at Vanderbilt University. That's quite an accomplishment, and we congratulate you for that.
Thank you so much, Mr. Chairman.
Okay,
Dr. Crutchfield.
Yeah. Next on the agenda, we have committee report for the Care Management Committee. And Anthony Williamson, chairman of that committee, would you like to give your committee report, please?
Thank you, Mr. Chairman. I was able to have a planning phone call recently with Lynette Rhodes, our Executive Director of Medical Assistant Plans. We had a good discussion about getting the Care Management Committee running again, looking at the topics that we wanted to focus on. And we are planning for our first meeting, which will include Mr. Folsom and Mr. Davis. We are targeting July 8th for that meeting to occur.
Thank you. Any questions from the board for Mr. Williamson, please? Hearing none, thank you for your report. And next on the agenda is a commissioner report, and I'll turn it over to Commissioner Berry.
Thank you, Mr. Chairman. And for those of you trying to log in, the password all capital DCH, B as in boy, OD as in dog. DCH, B as in boy, O, D as in dog in all caps. And again, thank you, Mr. Chairman. I want to just take a moment or two to reflect on the last 18 months. And while we have certainly begun to turn the corner and see COVID-19 in the rearview mirror, I wanted to recognize the leadership of Governor Kemp throughout this pandemic, and of course, Dr. Toomey. The two of them have been remarkable with an unbelievable steady hand, keeping all state agencies and state government operating efficiently and effectively under their leadership. It has been a remarkable experience to be a member of that team and to know that there was never any given day where we couldn't be in touch with each other on any issue that came up. And so I just wanted to make sure that people knew what an incredible job, not just with, as you read in the newspaper about keeping the state open, but just in the day-to-day operations that he has been leading. I also wanted to again recognize Kaylee Noggle and Ryan Loke and other people, David Dove from a general counsel's office who helped us with CON suspension requests throughout. Without their leadership, we would not have been able to be as successful as we've been. And then to the DCH team, who has just done beyond a remarkable job. Everything from the work that Mario and Joe have done, and Lisa Walker and Sean with staffing numbers of healthcare workers across the state in partnership with HWL. The spas, the state plan amendments that have been done on an emergency basis, and the volume of those that it took to make certain that people had access to the care that they so desperately were needing in new and innovative ways. All of that working together, I think, just put Georgia in an unbelievably positive place. I also certainly recognize that there have been many people that have lost loved ones, and we do not lose track of that. And I want to send out from the department's side a heartfelt grievance for you. Know that it's been an extremely difficult time for those that had people that we've lost. But I did feel it was important to just recognize the governor, our team here at DCH, and all of our providers that we've partnered with. With that, I'll turn it back over to you. Thank you.
Thank you, Commissioner, for those very appropriate, timely comments. Any questions or comments for the Commissioner, please, from the board?
Chairman Boyd, if I may interrupt briefly,
Yes.
Dr. Davis has joined now.
Good morning,
Tanisha, I
Dr.
think I have
Davis.
him on speaker on my phone.
Okay,
So I think
thank
we're
you for
okay.
joining us.
Okay, and we can hear you, and you're on speaker now, right in between Chairman Boyd and myself.
Any comments or for the Commissioner from his report from any of the board members, please? I just have one question for the Commissioner. When are we going to be able to get back to a personal, in-person meetings here so we don't have to deal with these issues?
I don't want to go too far out on a ledge, but I would suspect maybe by early fall, Mario, possibly, maybe. The real challenge is, as you know, our elevator banks in this building, not all of them work all of the time. So the volume of individuals that come in and out of the building, and then would get on just a few elevators, since not all of them work, is a big challenge for us as a 40-story building. So that's part of it. The other part is the health and safety of individuals as they come under the building. I think you've probably noticed there has been a significant increase in variety of different types of individuals that are under our building right now. And so we're working with both GBA and the city of Atlanta, along with Georgia State, to address some of those concerns. And it's more of a health and safety issue than anything.
So, thanks for that update, Commissioner. Thank you. With that, we'll move into our agenda items this morning. As I said, that's rather lengthy. We have 5 areas for consideration that we will be asked as a board to vote on for final adoption, and 4 for initial adoption. We'll move right into these, and first of all, we'll call on Kim Morris, Director of Reimbursement Financial Management, and she has 4 items for us to consider for final adoption. Kim, you may move through those as you finish one, you may move to the next. So please proceed.
Good morning. Today I'm presenting for final adoption a request to approve a 3% increase in the dental reimbursement rates for 15 selected dental codes, which would have an effective date of July 1, 2021. The total funds appropriated was $354,137. We had an opportunity for public comments on May 18th. And we also had written comments that were due to the department by May the 25th. The department did not receive any oral or written comments from the public. Are there any questions for the board? If not,
Any questions from the board for Kim Morris on this issue? Hearing none, is there a motion for approval for final adoption?
Motion to approve. This is David.
Mr. Trail has made the motion for final adoption, and is there a second to that?
Second.
Dr. Davis has seconded that. All in favor say aye. Aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much.
Thank you.
You may move on.
Yeah, the next is presented for final adoption, an increase for rates for 18 select primary care and OBGYN codes for the 2020 Medicare level. This would also be effective July 1, 2021. Total funds appropriated was $21,442,954. Had an opportunity for public comments on May 18, 2021. And written comments were due by May 25th, 2021. There were no oral comments received. There were 3 written comments received from Richard Ward, CAE, Patient Centered Physicians Coalition of Georgia, Linda Perry Gilks, MD, FACS, President, Medical Association of Georgia, Thomas D. Fawcett Jr., MD, FAAFP, President, Georgia Academy of Family Pediatricians. All respondents expressed support for the increase in the 18 select primary care and OBGYN codes. The department's response, the department appreciates the support and thanks the commenters for their responses. Are there any questions from the board members?
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval, Mr. Chairman. This is Folsom.
Roger Folsom has made the motion for approval. Is there a second?
Russ, second.
Russ Childers has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? The motion is approved for final adoption. Kim, thank you.
Thank
may
you.
move on.
Requesting for final adoption, approval to increase the Medicaid rate for the nursing home mechanical ventilator care program. This has an effective date of July 1, 2020. The department is proposing to increase the rate, the ventilator per diem by 5.9% from $556.77 to $589.62 per day. The total cost for the increase is $1,351,195. There was an opportunity for public comments on May 20th, 2021. Written comments were due by May 27th, 2021. We did not receive any oral comments. There was one written comment received from Donna Knackers, Vice President, Georgia Healthcare Association. Ms. Knackers expressed her support for the 5.9% increase in the nursing home ventilator per diem. The department appreciates that support and thanks her for her response. Are there any questions from the board members?
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion to
move.
approve. This is David Cruz.
David Cruz has made the motion for final adoption approval. Is there a second?
Trail.
Mark Trail has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Kim, you may move on to your last
Okay,
item.
my last presentation is the final adoption for the increase in the nursing home reimbursement rates to include updating rates to the 2019 cost report, the general and professional liability, property tax pass-through rate, and a 5% growth allowance, inflation factor, and a whole harmless provision for the first year. All of this is going to be effective as of July 1, 2021. Total cost for the changes is $104,433,079. The cost reports will be updated at a minimum of every 2 years. During this initial transition year, the department will apply a whole harmless provision to the nursing home reimbursement. And this provision would be in effect for the first year transition. Public comments were held on May 20th. May 20th, and written comments on May 27th. The department did not receive any oral or written comments. Did not receive any oral comments. We did receive one written comment from Donna Knackers, Vice President, Georgia Healthcare Association. Ms. Knackers expressed her support for the proposal. The department appreciates that support and thanks her for her comments. Are there any questions for the board?
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Russ Childers.
Mr. Trail has made the motion for final adoption approval. Is there a second?
Second, Russ.
Russ Childers has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. And Kim, thank you very much for your presentation this morning and providing us all of the background material that we could review in advance.
And excuse me, Chairman, I do have a correction. The public comments were held on April the 20th and the written comments were April the 27th. So when I said May, that was I misspoke.
Thank you for that correction. Thank you.
Thank you.
Okay. Next, we have Lynette Rhodes, Executive Director, Medical Assistance Plans, has 3 items to bring before us for one for final adoption approval request and the other 2 for initial adoption or approvals. So Lynette, you may proceed.
Good morning, Chairman Boyd, Commissioner Berry, and board members. Pending final adoption from the board and approval from the Centers for Medicare and Medicaid Services. We are proposing to increase the rates for all services provided through the Elderly and Disabled 1915C waiver, which includes the Community Care Services Program and the Service Options Using Resources for Community Environments Program. This is a 10% increase that will be effective July 1st of 2021. An opportunity for public comment was held on May the 18th, 2021. Written comments were due on or before May the 25th, 2021. No verbal comments were received. However, we did receive 2 written comments. Written comments were received from Donna Knackers, the Vice President of Reimbursement with the Georgia Healthcare Association, and Jenny Helms, the President of Leading Age Georgia. Both commenters were in full support of the proposed 10% increase and thanked the Governor's Office, the legislature, and DCH. In response, we appreciate the comments and we thank the commenters for their support. I will pause for any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
So moved, Mr. Chairman. This is Folsom.
Dr. Davis has made the motion for approval, and is there a second?
Second, Folsom.
Yeah, Roger Folsom has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you, Lynette, and you may move on to your next item, which will be considered for initial adoption.
Pending initial adoption from the board and approval from the Centers for Medicare and Medicaid Services, we are proposing to renew the Independent Care Waiver Program and to increase the reimbursement rates for all services provided under the Independent Care Waiver Program by 10%. The Independent Care Waiver Program is a 1915C waiver that authorizes the provision of home and community-based services to adult individuals ages 21 through 64 with physical disabilities or traumatic brain injuries who live in the community. Individuals served by the program are required to meet the same level of care for admission to a hospital or a nursing facility and be Medicaid eligible. The department is proposing to renew the Independent Care Waiver Program for 5 additional years. With the exception of the proposed 10% rate increase, we are not proposing any changes to the service types, descriptions, or maximum allowable units. The services impacted are listed in the public notice document. The chart includes the current rates, the proposed rates, and the fiscal impact to state and federal funds. The proposed rate increases will be effective July 1, 2021. This rate increase is based upon the appropriations in House Bill 81. The fiscal impact for state fiscal year 2022 is as follows. The total cost is $19,254,830.66. Of this amount, state cost is $6,074,899.07, and federal cost is $13,179,931.59. An opportunity for public comment will be held on June the 15th at 10:30 a.m. via WebEx, and written comments are due on or before July the 12th, 2021. I will pause for any questions from the board.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
I move approval, Russ Childers.
Russ Childers has made the motion for approval. Is there a second, please?
Trail will second.
Mark Trail has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved for initial adoption, and you may proceed, please.
Okay, and final agenda item, pending initial adoption from the board and approval from the Centers for Medicare and Medicaid Services, we are proposing to increase the supplemental quality incentive payments to eligible skilled nursing facilities. This adjustment will be effective July 1 of 2021. In 2007, the department implemented a quality improvement incentive program for skilled nursing facilities. The facilities must enroll in the program and meet the required metrics in order to receive the incentive payments. In 2021, the department added 2 new quality incentives. They were the American Healthcare Association and the Joint Commission Quality Awards. In order to receive the proposed incentives, nursing facilities must meet the nursing staff hours, the brief interview for mental status percentages. They must hire and retain an infection control specialist and meet the clinical and non-clinical measures. House Bill 81 includes funding for the department to increase the supplemental quality incentive payments for the eligible nursing facilities. For the nursing staff hours, the facilities must meet either 2.5 hours per day with a recommended 1% incentive payment, or 2.7 hours per day with a recommended 1.5% incentive payment, or 3 hours per day with a recommendation of a 2% incentive payment. They must meet the percentages outlined for the BIM scores, which are outlined in the public notice. And again, they must hire and retain an infection control specialist for an additional incentive payment of 2%. The financial impact is as follows. For state fiscal year 22, the total funds are $36,253,776. State funds represents $12 million, and the federal funds represents $24,253,776. An opportunity for public comment will be held on June the 17th at 10:30 a.m. and written comments are due on or before June the 24th, 2021. I will pause for any questions from the board.
Mr. Chairman, this is Mark.
Comments from the board?
Yeah, this is Trail. I do have one question. Are we still pretty satisfied that this is producing the kind of results that we had anticipated?
So, I'm sorry, Mr. Trail, I didn't mean to cut you off.
No, that's fine. I was just asking if we're still seeing the improvements in the homes that we had anticipated back in 2007.
We are, however, I would like to add in response, Mr. Trail, that we are going to continue to develop the quality incentive program. So for us, this is a starting point on that path. And so it is our intent to develop a more robust and comprehensive plan going forward. And we will continue to make adjustments and follow the recommendations from CMS. And, so just stay tuned for additional changes in the program going forward. And of course, we'll continue to monitor the results and make adjustments as needed.
Thank you, Ms. Rhodes. I'll yield.
Commissioner, do you have a comment?
I do. Thank you, Lynette, very much for the report and proposal. The other piece that's critical to this is in partnership with the association, but equally as important, in partnership with Chairman Tillery, the Senate Appropriations Chair, our chair of our committee, Dr. Burke, Chairman England from the House, and Chairman Parrish, our Appropriations Chair. One, we're grateful for their support, But they've made it very clear, and we agree, and the association agrees, as Lynette said, this is a first step. And we recognize that there is room for improvement. The nursing home industry as a whole is working extremely cooperatively with the department to address quality related issues. And we felt that this was the best way, really not even through COVID yet, to begin a quality approach. But as Lynette said, there will be improvements made over the next year, 2 years, 3 years, and it will be an ever-evolving quality approach that we've not really gone down the path of pursuing previously. So there's exciting work ahead, and I believe that by doing this in partnership with the association, along with members of the General Assembly and certainly the governor's office, we're going to have a very robust quality program over the next this year and as we move forward.
Thank you for those comments, Commissioner. Any further questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Trail will move.
Mark Trail has made the motion for approval for initial adoption. Is there a second?
Second,
This is David Cruz.
David Cruz has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you very much, Lynette. Next on our agenda item, I'll turn it over to Melanie Simon, and she has 2 items for us to consider for initial adoption. So, Melanie, you may proceed. Thank you.
Good morning, Mr. Chairman, Commissioner Berry, and members of the board. Can you hear me?
Yes, I think so.
Great, thank you. The Division of Healthcare Facility Regulation presents rules today for initial adoption. These are in Chapter 111-862 of the Department's Rules and Regulations, and they are the rules and regulations for personal care homes. These changes are necessary in order to comply with portions of House Bill 987, also known as the Disabled Adults and Elder Persons Protection Act of 2020. I am going to try to do a brief summary of the changes. These are comprehensive, and at the end, I'll certainly pause to see if you have any questions. So first, we are clarifying the definition of physician in the rules to include nurse practitioners or physician assistants where those professional groups are able to perform the particular services under the appropriate scope of practice rules in the Professional Licensing Board. So we're not changing the scope of practice. We're just making it clear that if we use the term physician in the rules, it does include nurse practitioners and physician assistants if those professions can perform those services. The second change is to require a financial stability affidavit for initial applications of personal care homes licensed for 25 or more beds. This has to be presented as part of the application process. The affidavit must be executed by a Georgia certified public accountant and indicate that the facility has the resources to operate as a going concern for 2 years. The next requirement is to require a certificate for memory care services. This is for personal care homes of any size if they have a memory care center. A certificate is required if the personal care home charges more for care to Alzheimer's or dementia residents, or if it represents to the public that it is providing memory care services. The next requirement is to require that administrators of personal care homes with 25 or more beds obtain a license from the State Board of Long-Term Care Facility Administrators. Those rules are already in place by that board, which is regulated under the Georgia Secretary of State. Also, we're adding a requirement of 60 days notice to the department and to all residents for any bankruptcy or property eviction at a personal care home, and 30 days notice of any change of ownership. We're also increasing the staffing requirements for personal care homes with 25 or more beds to new ratios of 1 direct care staff for every 15 residents as a monthly average in the daytime and 1 to 20 at night. Previously, it was 1 to 15 daytime and 1 to 25 at night. This is a minimum requirement. The facility always has the obligation to meet the residents' needs, and to add additional staff is appropriate to address those needs. Also, there is a new requirement to make the name of the personal care home visible from the street. Currently, the rules only require that the street number be posted, and this has been a safety issue for 911 situations. We're also adding a new aging in place exception. This is only for personal care homes. Unlike assisted living communities, personal care homes cannot have non-ambulatory residents. The fire safety standards do permit the department to allow up to 3 non-ambulatory residents to remain in a personal care home as an aging in place strategy, but currently that process requires a waiver. This is a very paperwork intensive process, both for the facility and for the department. In order to simplify that process, we are putting those aging in place requirements into the rules. So in order for the facility to retain a resident who has become non-ambulatory, they must be able to meet the resident's needs, have sufficient staffing to care for the resident, conduct monthly fire drills, and demonstrate that they can safely evacuate all residents within 13 minutes. They're also required to notify their local fire department that they do have a non-ambulatory resident. We're also adding staffing requirements for memory care centers in these rule changes. Those ratios are 1 to 12 daytime and 1 to 15 at night. Again, that is a minimum requirement. Memory care centers are also required to have a registered nurse, licensed practical nurse, or certified medication aide present at all times in the facility. And they have to have 2 direct care staff present at all times, 1 on each floor if it is a multi-floor facility. Memory care centers are also required to have a registered nurse or licensed practical nurse for a certain minimum number of hours per week based on the number of residents. For up to 12 residents, 8 hours a week, 13 to 30 residents, 16 hours a week, 31 to 40, 24 hours a week, and over 40 residents, 40 hours a week. We've also added training requirements to support memory care, both initial orientation training and ongoing annual training. And I want to add that we have received some very helpful feedback from the Georgia Alzheimer's Association on training tools and checklists, and we really appreciate their engagement with the department on these issues. And finally, there is new certified medication aid language in the personal care home rules to allow CMAs to work in memory care centers that are located in a personal care home. Previously, certified medication aids were only allowed in assisted living communities. We will be having a public comment hearing on these changes on July 14th at 10 a.m. It will be a web event. We will accept written comments on or before July 16th of 2021. And now, Mr. Chairman, I will pause to see if there are any questions about these changes.
Any questions or comments from the board, please? Lynette, that was a very detailed presentation. Appreciate that very much. Is there a motion for approval for initial adoption, please?
So move, Russ Childers.
Russ Childers has made the motion for approval initial adoption. Is there a second?
Second, Folsom.
Roger Folsom has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none. Melanie, it is approved for initial adoption. And you may move to your next item on the agenda.
Thank you. The Division of Healthcare Facility Regulation also presents rules today for initial adoption for assisted living communities. These rules are found in Chapter 111-863 of the Department's Rules and Regulations. These are predominantly the same as the provisions I just reviewed for personal care homes, so I'm only going to go over the items that are different in these rules. We do not have any aging in place language being added to the assisted living community rules, since assisted living communities are already allowed to have non-ambulatory residents. Also, assisted living communities already have certified medication aides, and so that language is not being added in these rules either. What is different for assisted living communities is that they can now provide limited nursing services, and those services are defined as anything that is within the scope of practice for nursing in Georgia that can be done intermittently or that can be completed within 7 days. In order to support these limited nursing services, assisted living communities will now be required to have a registered nurse or licensed practical nurse on staff for a certain number of hours per week based on the number of residents. And those requirements are for 1 to 30 residents, 8 hours a week; for 31 to 60, 16 hours a week; for 61 to 90 residents, 24 hours a week; and for facilities with over 90 residents, 40 hours per week. Additionally, assisted living communities are required to have 2 direct care staff present at all times. So those are the changes that are different. Other than that, all of the other provisions that were reviewed related to memory care and the financial stability affidavit and the other requirements are also being put in place for assisted living communities. We will have a public comment hearing on these proposed changes on July 14th at 10:30. It will be a web event, and written comments will be accepted on or before July 16th of 2021. And I will pause again to see if there are any questions from the board about these changes.
Are there any questions, comments from the board for Melanie, please? Hearing none, is there a motion for approval for initial adoption?
Trail, so move.
Mark Trail has made the motion for approval for initial adoption. Is there a second?
Russ,
Dr. Davis has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Melanie, thank you very much. Thank you for the presentations and providing us the information to review in advance. With that, we have concluded the items we were to consider for voting today. I believe I'm correct, and Denisha, you tell me if I've got the date right. I believe there's a special phone call request for the board to participate in on June 29 at 10 a.m. I think we have that.
It's at 10:30. It's at 10:30 a.m.
It's 10:30.
Yes, and I will
Okay.
note that it will only be for the one item on the agenda, the quality incentive public notice.
Okay, thank you, Denisha. Anyone have any other items and new business, anything that needs to come before the board at this time? Hearing none, we are adjourned, and I think it's like to remind everybody, and I'm sure we all know Monday is Flag Day, and it's so nice around the state of Georgia and the areas that where I go anyway, how many communities are prominently displaying the flag, and I think that's a great and positive thing for us. Thank you so much for attending today, and have a good day. Goodbye.
Thank you.
Thank you.